So I got the referral and was finally able to get in to see an endocrinologist, and this would have been about April of 2016. And with the initial consultation and discussion and exam, they also took probably 6 or 8 vials of blood so that they could run obviously some lab work on me to check different things, whatever might be causing the issue. So about a week later, went back for the results, and it came back that pretty much everything was okay except that I had my vitamin D was really low, my calcium was low, my testosterone level was low, couple other things, but nothing any big deal. So we didn't really at that point talk about much from what could have caused those things versus we talked more about what we would do to treat it. So the treatment was take a vitamin D supplement, and I think it was 2,000 units a day at the time. Take some calcium, and then we started a testosterone treatment, which was I won't mention the brand, but it's essentially the gel that you put on your shoulders, and it was you put one dose on both shoulders once a day. So we did that, and then it was I'll see you in 3 months for a follow up. We'll see how you're doing then. So fast forward 3 months. Meanwhile, I'm still on crutches. I'm still dealing with the pain in my feet and in my femurs. So and then I actually started going back to I also started going back to a physical therapist around that time frame because again I thought, well, I'm just getting weaker from being on the crutches for so long, and I needed to at least keep some sort of movement and flexibility and that kind of stuff going. So I started going back to the physical therapist. So 3 months later, I go back for my follow up. He takes more blood. Results come in. The vitamin D's up a little bit, not a whole lot. The calcium is up a little bit, not a whole lot, and the testosterone's up a little bit, but not a whole lot. So treatment at that point was, well, let's go to 5,000 units on vitamin D. Keep doing your calcium, and we're going to double the testosterone thing. So like I said earlier, instead of one pump on each shoulder, it became two on each shoulder. Not a big deal. So, and then it was, I'll see you in a few more months, and we'll check you again. So 3 more months go by. Now we're sitting at around October of 2016, and I go back for the follow up. And during the physical exam, I mentioned to him, again about how my left leg was getting some swelling, and I'd mentioned it to him. I think it was the 3 months prior, but we didn't really think about it too much. I mean, we kind of associated it with basically my immobility, that I was having to deal with from having the fractures and stuff. That was probably just some anemia or something like that, or anemia from that. So, but this time he says, well, let's see if we can get you in for an ultrasound to see what's going on, because we did talk about, well, I mean, at this point we need to look and see if it's a DVT or not, particularly since I had basically the trifecta for I guess getting one, which was the fracture in the long bone of your body, the immobility, and now being on testosterone treatment. So I said, okay. So they were able to get me in that day, where his medical office is. It's actually in a building that has an emergency department and radiology, and they do that sort of imaging there. It's not a hospital, but it's just an office building with that capability. So got in for that, and this was all new to me, obviously, and I'm somewhat of a pessimist to where I'm thinking the worst. I'm thinking they're going to find one, and I'm not sure what's going to happen. So it made me nervous, obviously. So when we're doing it, I'm laughing and joking and trying to cut up because I'm a little bit of a smart ass anyway. But I'm even more so one in a joking way when I'm nervous. So of course, I'm trying to make small talk and joke and just do whatever. during this procedure, and the technician who was doing it, was the same way. But I said, well, I know something's wrong when she kind of got serious all of a sudden, and stopped kind of kidding around, and then at the end of it, she just said, well, don't leave until you hear from the doctor. And I thought, well, that's a little strange, or at least I thought it would be strange. I mean, I never had one done, so I didn't know if that was normal or not. So she wheeled me back out to the lobby, and I say wheeled because I was in a wheelchair, with what I was going through with the fractures in the feet and the hips. It's a big building, so my girlfriend would drop me off. She dropped me off at the front, and I would get in a wheelchair, and then we would just wheel around the place, versus doing all that walking. So she takes me back out to the lobby, and my girlfriend's out there, and I tell her, I said, well, I'm not sure what this means, but she told me not to leave until I hear back from the doctor. So about 30-45 minutes go by, and then they bring a phone out, and it's my endocrinologist, and he said the radiologist read it, and that it looks like I have a DVT from my pelvis. This is on my left side, from my pelvis to just below my knee, and that I needed to go check myself into the emergency department right there for further analysis and treatment. I said, great. So I wheel over to the desk there, and I said I need to check myself in. And so of course the first thing they do, or one of the first things they do, is to do a contrast CT of my lungs. Sorry, you may have heard my dog shaking his ears in the background and his leash going off. So anyway, they did a contrast CT of my lungs to see if there's any PEs, which is a pulmonary embolism, which is basically if part of the blood clot breaks off and then it travels and it gets through your heart, it could either get to your brain or in a lot of cases gets to your lungs, and they call that a PE at that point. So they do that, and then we're sitting there in the room waiting for the doctor to come in, and eventually she does and says, yeah, you've got a PE. We're going to start you on some treatment. We're going to have to admit you overnight, which means I needed to get transferred to a hospital. But then she says, well, how did you get the fractures in your ribs? And I said, what fractures? And she said, well, the report came back and shows that you have multiple bilateral healing rib fractures. And I said, well, how many? And she said, well, it doesn't say, but it just says multiple. And I said, well, I don't know how I got them. Now, before this time, I didn't really have any pain to indicate that I had fractures. I mean, I had some pain in my back and high up in my back, kind of on the left and right of your spine, or of my spine, but I associated that with sleeping on the couch. I mean, because I have a 2-story house, so dealing with the fractures in my feet and my hips, while I could get up and down the steps to get ready for work or to do whatever, our bed is high, so to get in and really to get in it would put too much pressure on the fractures in my femurs, so I was just kind of camping out on the couch. So I associated the back pain I was feeling with kind of muscle soreness or something just from sleeping on couch cushions versus obviously being on a mattress in the bed. So we thought obviously that was odd that I would have fractured ribs without even knowing how it happened. So anyway, they finally get me transferred to the hospital. The next day, I get put on, after getting the series of shots in my stomach for the initial round of treatment for the DVT and the PE. They put me on one of the new blood thinning drugs and sent me on my way. I mean, I was out the next day, which kind of took me by surprise because I've known folks who have had similar circumstance and was in the hospital for a week. So I wasn't sure why I was getting let out, but trust me, I wasn't complaining. So I got released, and then the instructions were to obviously follow up with a hematologist, for further, follow-up and evaluation because of the DVT and stuff. So I get out, and from that day on, now this was mid-October 2016. And from that point on, I mean, I really had the worst pain that I've ever had since this whole thing started. I mean, just throughout my body. And the only thing I can associate that with, or at least at the time, was the blood thinner that I was on, because that was really the only new thing that I was dealing with, or that was that I was dealing with. So, and I did consult Google and saw that was some reviews, that was some feedback that folks left for this particular drug, that it can cause muscle and joint and bone, just overall bone pain. So I'm like, well, great, that's just what I need right now. But I didn't have a choice. I mean, I have to take it. So what else is someone supposed to do? So in the meantime, it was discussed to, again, we got to figure out why I'm having all these fractures. So they ended up ordering a full body nuclear bone scan, where they inject this dye or something in you, and then you basically get a skull to toe X-ray, if you will. So we did that, and now this, I think, was around November of 2016, and they discovered that not only did I have the ribs in the femur and the feet issue, but I also had fractures in my scapula, my clavicle, my upper lumbar, my lower lumbar, my spine, pelvis. Obviously, the femurs were still there, the ribs were still there, healing, and left ankle, and then also the feet. I was like, man, this is just getting better and better. So they did rule out, that it was any sort of cancer, any kind of bone cancer or anything like that. They were able to rule that out from that test. But it still left the question as to what could be causing it. So the next step was to order a genetics test, where they wanted to test me for something called osteogenesis imperfecta. So again, the next thing I needed to do was go see a genetic doctor.